Hello, my name is Samantha Green and I have been working in a local authority maintained school for the last 10 years. Originally in Key Stage 1 and 2, supporting children with medical and behavioural issues. Just as Nutt Brown released her Foundations for Quality document in 2012, I began working in Foundation. Nutt Brown's document brought many changes to the role of the teaching assistants within the early years, as more responsibility was placed upon them. For example, in Key Stage 1 and 2, teaching assistants would not have to record children's progress. This was simply done through conversation with the class teacher, who would then assess, record, and plan for future lessons. However, in the early years, teaching assistants are expected to take responsibility of a key person group. Currently, in my key person group, there are 19 children. I am expected to monitor, record, assess, and plan any future learning. In order to do this, it is good to have a knowledge of the early years curriculum. This is outlined in the Development Matters document, which gives guidance and support to early years workers to underpin the requirements of the statutory framework for the early years foundation stage. This document sets out the standards for learning, development and care of children from birth to 5 years. This document was updated in 2017, outlining the need for Level 3 practitioners to have a Level 2 qualification in English and Maths. The document also states that newly qualified Level 2 and Level 3 practitioners should hold a full paediatric first aid certificate or emergency paediatric first aid certificate within 3 months of starting work. The framework also states staff to child ratios, depending on the child's age. This is a policy I feel my setting regularly breaks. The framework states in our setting that there should be one adult to every 4 children aged 2 years. And when a person with qualified teacher status, early years professional status, early years teacher status, or another suitable Level 6 qualification is not working directly with the children, there must be at least one member of staff for every 8 children. However, whilst holding a Level 3 qualification, my pay scale was changed to a Level 6, so I could take and run the classroom in the absence of the teacher. This meant I was expected to look after 13 children at any one time, and because my colleague who works with 2-year-olds had low numbers and may only have 1 or 2 children, she would also be expected to have 8 children. This was raised with the foundation leader, who said that she had referred this to the local authority and it was okay. Nutt Brown also identified the need for early years professionals to be confident in their practice and to communicate with other professionals, such as health visitors and social workers. However, communication between different professionals still can be limited. This could be for many reasons. For example, time constraints. Often, health visitors have heavy workloads and find it difficult to schedule meetings with early years practitioners. There is also a fear of breaking data protection laws, and more recently, the new General Data Protection Regulation. However, Following the implementation of the Children and Social Work Act of 2017, the Working Together to Safeguard Children document was published. This document applies to all organisations and professionals working with children, and it sets out what organisations must do to safeguard and promote the welfare of all children and young people under the age of 18 in England. The safeguarding of children under Article 19 of the UN Convention on the Rights of the Child agreed that all children should be protected from all forms of violence, abuse, neglect, and bad treatment by their parents or anyone else looking after them. As a school, it is the responsibility of everyone to ensure that any concerns are logged with the designated safeguarding officer. Within our organisation, all concerns are logged on a computer system called CPOMS. We log any concerns or communications we have had with parents or carers. If there are marks on a child, the system allows us to body map, and if the child has siblings or other relations that are connected, these children can also be linked on the system. Once something has been logged, no one is able to change any statement except the designated safeguarding officer who holds a key to access these accounts. Article 2 of the UN Convention on the Rights of the Child also sets out the human rights of every child without discrimination, whatever their ethnicity, gender, religion, language, abilities, or any other status. Although there are many ways within a setting we can try to include every child. We also work closely with parents and children to celebrate customs and religious festivals. So this may include Chinese New Year, if we have a Chinese child attending. In the nursery setting, we also have one practitioner who is Hindu and another one that is Sikh. So each year we celebrate Diwali. Recently, the Thursday before the beginning of Lent, we researched and celebrated Fact Thursday, the Polish version of Shrove Tuesday, where it is traditional to eat donuts and angel wings, a sweet pastry before the beginning of Lent. All organisations that provide education at any age or care for children and young people in England are inspected and regulated by the Office of Standards in Education, Children's Services and Skills, better known as Ofsted. Guides for inspecting the early years are set out in the Early Years Inspection Handbook. The handbook outlines the requirements and expectations set under Section 49 and 50 of the Childcare Act of 2006. Nutt Brown recognised that early years carers and educators were professionals who needed to continually develop their knowledge, skills and understanding. With the reduction of school training budgets, schools have had to become frugal. So, it is not uncommon for 1 or 2 members of staff to attend training sessions and feed back to their colleagues when back in school. Usually, these types of courses do not have a qualification at the end. So it's a cheaper way to keep the workforce up to date with current policies, legislation, and the latest education programmes available. Another cost-effective way that schools try to ensure that their workforce is up to date with current policies and legislation is online training. The school where I work uses the Educare programme, which provides staff with duty of care and online safeguarding training courses. There is no limitation on the amount of courses an individual can access, and certificates are given at the end of each course as evidence of successful completion. The head will set dates for certain modules to be completed, but it is up to the individual if they wish to complete other courses. However, when working in early years, there are some courses that each individual have to attend away from the setting. For example, as mentioned before, all newly qualified Level 2 and Level 3 practitioners should hold a full paediatric first aid certificate within 3 months of starting work. Within our setting, all practitioners, including teachers, hold a full paediatric first aid certificate, and these are updated every 3 years. Needless to say, this only applies in the foundation. In the rest of the school, there is only a select number of staff first aid trained, all being either teaching assistants or office staff. So, in conclusion, it is important that early years practitioners have achieved a minimum standard of education and completed relevant training as mentioned earlier. This ensures a higher level of knowledge with regards to children's needs and requirements. Thank you for listening.